Today I'm going to give a talk on what is called chronic lymphocytic disease. Chronic lymphocytic disease is also called Hashimotos Thyroiditis. These conditions occurs when the immune system starts to attack the butterfly-shaped thyroid gland. So when this so happens, the thyroid gland will present sonographically with hyperperfusion. At the same time, the gland can actually enlarge and it can have a coarsened echo texture. The same sonographic appearance, however, can also present in what is called Graves' disease. In this talk, I'm not going to explain or to dwell much into this condition which is called Graves' disease that can have overlaps in terms of sonographic appearances with Hashimoto's thyroiditis. However, you are supposed to know or to take note that the major differentiation between Graves' disease and Hashimoto's thyroiditis is made from laboratory tests and the findings. Here is a case scenario of a patient who was clinically known to have the condition of Hashimoto's thyroiditis. What are the findings sonographically? So what we are seeing here is the right lobe of the thyroid, and you can see that there is chaotic flow here on the lobe. So this type of flow or hyperperfusion that we are seeing is what is typically called the Thyroid Inferno. So when we have got this type of hyperperfusion, it depicts an inflammatory process that the gland is actually receiving increased vascularity or hyperemia. So using a different grayscale, you can actually see that there is still chaotic flow here, which is typical of what I am referring to as the Thyroid Inferno. You can see our jugular vein here, and here is our common carotid artery. So this is our right thyroid. You can see that the appearance is almost diffuse in nature. However, it's not enough when you're doing a bilobed organ ultrasound scan to assess only one lobe and neglecting the other. So in this context, we are supposed to scan both the right and the left lobe, not ignoring the ischias of the thyroid gland. Also, perfusion can be different between power and color Doppler. So on interrogation on power Doppler with improved sensitivity, we also saw that the patient had the chaotic perfusion, which is typical of our Thyroid Inferno. This is a capture that is trying to show both lobes on the same view. As you can see here, you can actually see this chaotic flow and chaotic flow here. What we have here is a thickened ischias. So our ischias is actually thickened, and it actually connects the right and the left lobes of the thyroid. This is our trachea here. So proceeding here, you can also see that the thyroid gland itself is got a coarser echo texture. This is characteristic of our Hashimoto's thyroiditis. And then you can see the ischias is actually thickened. Playing it again, you can see this is the contralateral lobe. So you can see the chaotic perfusion. The characteristic Thyroid Inferno is presenting here, and we can see here our left jugular vein. So this is acceptable, and this is what must be done routinely when you're doing an ultrasound scan of a duplicated organ. You have to compare the two lobes or the two sides. So this is our left lobe, and then this is our right lobe. As you can see, there is homogeneous or a uniform Thyroid Inferno in both lobes. So what we are seeing here is a Thyroid Inferno that is extensive and is affecting both lobes. So you can see that this is diffuse Hashimotos thyroiditis. Thank you guys, thank you all for watching our tutorials. I hope you're enjoying. More videos are coming. Don't forget to subscribe and share our videos. If you have got any questions, feel free to ask via our comment section. We will respond. Also, if you have got other recommendations, feel free to contact us. Thank you so much. Be blessed.